thank you so much for your time. I suppose as a bit of background, this letter that you have penned and signed is in solidarity with Dr. De Meyer and the issues he raised.
Good morning, Bongani. Yes, most certainly. Dr. De Meyer, I think, struck a nerve when he published his open letter after months of going through the channels to obtain proper provisions for the hospital to prevent needless deaths and needless debility among patients and pregnant women there. And I think what he did lit a fuse, because these problems are quite systemic. And there have been many health workers, health professionals trying to speak out, and when they have been similarly intimidated and threatened. So when Dr. De Meyer did this, I think there was a broad understanding among health professionals in our institutions in Gauteng that this situation is untenable, and an unprecedented protest took place.
We've, of course, spoken to Dr. De Meyer. We spoke to him at the time, and he tried to explain what was going on at Rahima Moosa. You say this problem is quite systemic, so he highlighted problems at one hospital. Can you give us a picture of what you and your colleagues are contending with at others?
Well, public health professionals working in our hospitals, will give you volumes of stories about how the administration of the system here is so out of keeping with running the most complex health system on this continent, which is in this province. And the kind of, negligent administration has brought the system to a point of incipient collapse. So if you take the example of Charlotte Maxeke's fire last year in April, it's a year later, to fix it is only now coming together after a year of bickering between the Department of Health and the Department of Infrastructure about whose job it is to fix the hospital and to pay for it. But what happened in the meantime, you took out a major cog in the entire system of public health care. The other hospitals picked up the slack for a while, but of course, it could only be for a while. And then the pressure became too much. So you're finding breakdown in services at our other tertiary institutions, particularly here in Johannesburg. You'll find this in all of our hospitals, Bongani, across the board in our public health system.
And are internal mechanisms to highlight some of these problems, to highlight some of the frustrations healthcare workers are having to deal with, are those sufficient enough to actually result in some change?
No, quite evidently not, because this has been a problem of many years standing, and the channels have been used with very little effect. So I think what this I Am movement basically signifies is a complete frustration and a demand that the system of administration of our hospitals change. Because the current system is a kind of remote-controlled management, often by people not quite suited to managing such a complex system centrally anyway. But it's this remote-controlled management that appoints a CEO at a hospital, not the hospital board appointing the CEO, and therefore only being accountable to head office, which means the local constituency at the hospital has very little traction and has to just do what they're told. And here's the bigger problem. Any attempt to speak outside your conditions of service is met with huge intimidation, huge victimization, and health professionals who are working there and whose careers are based there, either feel, that they have to leave because of the absolute moral injury they face, because of the lack of provisioning contradicting their ethical frameworks, or they have to speak out, as Tim De Meyer did, and as many others have tried to do.
Current events, developing stories,
tough questions,
your voice making a difference.
This is Breakfast with Bongani Bingwa.